Today, we will discuss meningitis. Let's see what it is. Meningitis occurs globally, but is worse in some places than others. This disease is very serious and can kill. However, it can be treated so that people do not die. Meningitis is inflammation of the meninges, which are the covering of the brain and the spinal cord. It is most often caused by bacterial, viral, and fungal infection. This disease is common in children, and it may begin as complication of other diseases such as measles, mumps, malaria, or even as an ear infection. Community health workers, parents, and carers can all play a role in reducing the number of deaths caused by meningitis. It is important to look for any of the following signs, particularly in infants and children, but remember that meningitis can also affect adults. A high fever is a common symptom and can be accompanied with vomiting, severe headache, and a stiff neck where the child looks very ill and lies with his head and neck bent backwards. In babies less than 1 year old, the soft spot on the top of the head, known as the fontanelle, may appear swollen, known as bulging fontanelle. Sometimes a child suffering from meningitis may also experience fits or convulsions. At the late stage of meningitis, a rash may be visible on the child's skin. If you have a glass available, it is possible to do the tumbler test. If the glass is pressed firmly against the rash, it will not fade and will remain visible through the glass. If this happens, you must seek medical advice immediately. But remember, you must also be aware that a rash does not always appear in a sick child or adult. Sometimes early meningitis can be hard to recognize, but the child may also cry in a strange way, even when the mother puts the child on her breast for feeding. The child may be unusually sleepy and unresponsive.
Often the children get worse and only become quiet when they lose consciousness.
In other children and adults, you may notice that they dislike bright lights. Not all of these symptoms will appear. Even if just one symptom appears, you should take the situation very seriously and act as soon as possible. Remember, meningitis can kill. Treat appearance of any symptom very seriously and seek medical assistance immediately.